That's all. But again, you do your own decisions. We are here to encourage, empower, and motivate you. Again, encourage, empower, and motivate you to discover the best version of yourself. In the workshop, start over. And then, number 2, in the consultations for work permits, entry visas, and much more. And also, we open, guys, our new products. Consultations for students, okay? Consultations for students. Again, I will share with you the pros and cons of every single career across the stage. If you don't like to listen an honest review, if you don't like to listen the pros and cons, maybe we are not for you. Maybe you are suitable for another coach. We are not coaches, just to clarify. We are educators and trainers. Maybe you are eligible to work with gurus. You are not guru, okay? You are eligible maybe to work for with another professionals. It's absolutely fine. No hard feelings, nothing like that. But here, it's my job, it's my responsibility. I will share with you the pros and cons of every single job, every single career. For sure, in my vision, you can disagree. I have another collaborators here to better assist you. There's another guys, they will pass their visions as well, their their clinical eyes. These guys are in the country for a lot of years, okay? We have either professionals living in the country for a lot of years and also professional students right now with us, okay? But yeah, let's go. Let's stop the conversation. Let's start now. I'm going to share with you very quickly and concise what is the difference to be a caregiver and one healthcare assistant. Are you ready? If you are prepared to listen honest review, come along and stay with us. If you don't feel prepared, you are not ready, absolutely fine. Come back in the future. Maybe you are not ready. Super. Very good. Come back in the future and then we can work with you. Okay? Let's go. Alright. What is the difference of to be a caregiver and a healthcare assistant? Wow, so excited. Let's go. Caregivers and healthcare assistants in the country, it's the same. If it's the same, can you share with us? If it's not the same, what is the difference? Yes, let's go. No, absolutely not. It's not the same, right? Healthcare assistants and caregivers are not the same job. Why? Tough their roles, okay? Tough their roles can overlap, okay? A healthcare assistant is a trained professional who works in medical settings, assisting and working alongside with doctors and nurses with clinical tasks like taking vital signals and basic patient care, okay? A caregiver provides more general, pay attention, a caregiver provides more general guidance, more general help, more general support, okay? And and then often non-medical support for daily activities, which can include personal care, household tasks, and companionship, with or without medical training. Guys, again, what is caregiver jobs? What is that? Again, a caregiver is the professional responsible for, okay? The caregiver can provide more general, often, sometimes non-medical, okay, help. The caregiver can support you in a daily basis with daily activities, which can include, number 1, personal care, number 2, household tasks, number 3, companionship, okay? And then with or without medical training. A caregiver can be experts okay, qualified. A few caregivers, they can have medical training or not. It's not mandatory to have the medical training. The majority of the caregivers do not have medical training. I can see caregivers, oh yes, they have medical training. Depends, okay? I need to evaluate who you are. I need to check out your CV, your cover letters, your LinkedIn. I will evaluate as well your degrees. I will ask you a couple of questions. I do have one questionnaire like 20, more than 20 questions. And also I will check all your degrees, all your certifications, whatever. I will check everything. In our paid workshop, start over again your career in the country. And then I will evaluate all your background, skills and abilities. And in the final, I will pass for you. Let's imagine, we are not doctors, but I'm going to use this word, okay? Just like a diagnostic. I will pass for you, let's say, okay, we discovered that we don't have medical training. You might be eligible to apply for jobs that don't ask for a medical training, okay? If you have medical training, you can apply for job roles. It's a caregiver that they're asking for a little bit medical training. If you have this training, if you don't have, you cannot apply, okay? Let's go. And Stella, what is healthcare assistants? Look, healthcare assistants, they can work in the hospitals, in clinics, and other medical facilities, okay? The duties, pay attention to the duties of one healthcare assistant, okay? The duties are clinical support such as taking and recording vital signals like temperature, pulse, blood pressure, assisting with medical procedures, and then the healthcare assistants, they can also do washing and dressing patients. They can support with washing and then dressing patients is another thing that they can do, okay? And lastly, providing support to the medical staff. Pay attention, this is extremely serious job, okay? The healthcare assistant guys, they work alongside with doctors and nurses, okay? They are working alongside with doctors and nurses. They are never alone. They work alongside. Stella, what is alongside? Together. Alongside, together. For example, they are working by the supervision of the doctors and also the nurses, okay? They cannot take a lot of decisions by themselves. It's necessary to work together with doctors and nurses. And for that, healthcare needs a very serious background, a very serious qualification. Healthcare assistants is not for everybody. Keep in mind that, okay? Let's go. One of the trainings involves professional training and often medical certification, okay? I will share with you which trainings, which medical certification you should do to be one healthcare assistant, okay? In my professional workshops, I'm going to share with you over the Zoom or over the phone call, but it's better over the Zoom call in my consultation with you, in my masterclass, which training is that, which certification you need to be a healthcare assistant, and all the skills and abilities that is mandatory for you to be a healthcare assistant. All right, let's go. Caregiver, it's setting. Number one, primarily individuals' homes, but can also be in care homes. What is that? The caregiver normally they can work directly. For example, they can work alongside in the house of the patients, okay? In the house of the private patients, okay? For example, there are a lot of patients, you know, kids, teenagers, or elderly people across the station. Then normally they call the agencies or they call the another companies to ask for caregivers. Sorry. To ask for caregivers, okay? And then the agency or the company experts in caregivers, at caregiving jobs, they will contact the best caregivers, okay, with entry levels, intermediate level, or senior levels to better assist that family. Which family? The private families, because it's quite normal in the country. The families call the agencies, okay, call the agencies directly to ask for caregivers, to ask for referrals of caregivers. Okay, let's go. And the job to be a caregiver, normally it's in the house of the patients. Can it be either live-in jobs? Live-in is just like when the caregiver is able to sleep in the house of the patients, or live out. What is live out, Stella? Live out, it's when the caregiver come back, okay, come back for her own house. Not necessarily sleep, not necessary, sorry, not necessary overnight, nothing like that, okay? The house, the caregiver come back for her own house. If this is a man, a professional man, the guy, him, will come back for his house, and in the next days going for the job again. Okay, let's go. Duties. Which duties? Oh, sorry. Another job, another place to work as a caregiver. Pay attention. Number one, private homes, directly in the house of the patients. Number two, care homes. What is care homes? Care homes that it's just like specific places where the families, the Irish families, okay, if this is one Irish family, okay, one Irish patients, normally the families put the you know, the relatives, the loved ones, the beloved ones in these care homes. These care homes will take care directly of the patients, and then in the care homes they have a specialized experts, caregivers to take care of these patients, okay? These patients normally they are about 6 years old, okay, just like 60, 65 more, okay? Normally it's more elderly people, okay? I might be able to explain for you the difference of the house of the patients and this care homes. It's not the same. The house of the patients, it's very private. Their rules, their culture, the mindset, it's what they are looking for, okay? Which kind of caregiver they expect, you know? It's very, very personalized, okay? I can explain for you the difference. And then the care homes, it's one place, okay? It's one specific place, just it's a company. The families put their relatives, their beloved ones, to stay in this place for a couple of weeks, a couple of months, and then the caregivers will take care of these guys, these patients in these care homes. Okay, guys, care homes. Let's go. Which duties the caregivers will do in this place? Number one, they will focus on personal care and assistance with activities of daily living, AGLS, it's daily living, okay? Such as bathing, feeding, grooming, and mobility. Again, the caregivers, one of the duties on a daily basis, guys, is just like bathing, feeding, grooming, and mobility. And then they also often assist the patients with household chores or household tasks. It's the same, just like meal prep, meal preparation, laundry, and lastly shopping. I would like to complement over here driving. A few caregivers, they are capable, they are able to drive. They are drivers. They have for sure international driver's license. A few caregivers that I know, they have Irish driver's license. But again, it's not mandatory all the caregiving jobs be a driver. A few jobs ask for you to be a driver. I will pass for you further details in my paid workshop. Start over your career in the country, okay? Let's go.